Hi, I'm Mary Mayhew. I'm the Secretary for the Agency for Healthcare Administration. I would like to spend a few minutes discussing how Governor DeSantis and I came up with our plan to create COVID-positive units and facilities, and how we are keeping your loved ones in our long-term care facilities safe. We have learned much about the COVID-19 virus since it first appeared in Florida earlier this year. It is easily spread from person to person. It is spread by people who have no symptoms and can pass through typical screening procedures through no fault of their own. It is a long-term pandemic, and healthcare providers, including long-term care providers, must learn to provide regular care while managing COVID patients. From day one, our plan was and remains to protect your loved ones in our long-term care centers. The governor established screening processes, PPE requirements, testing of staff and residents, and mobilized AHCA, the Department of Health, county and federal teams to assist long-term care facilities with infection control procedures. We also initially transferred COVID-positive residents to hospitals to stem the spread of COVID in our facilities. But that is not and was not a long-term strategy. We had long-term care residents in hospital beds who did not need hospital-level care. Many were asymptomatic. Eventually, our long-term care providers were able to obtain sufficient personal protective equipment, access to testing, and the infection control skills necessary to care for COVID-positive residents. My staff and those from other agencies also learned what long-term care facilities needed from us to support their caring for COVID-positive residents. We have implemented testing and contact tracing for residents when COVID presents itself in a facility, bi-weekly testing of all staff, and the requirement of any service provider who enters a long-term care facility to be tested, infection control training and inspections. With this knowledge, we created a program for nursing homes to create COVID-positive units or whole facilities to care for nursing home residents. This freed up hospital beds for those who truly need hospital level of care and allowed residents to receive care in the most appropriate setting. Armed with the proper PPE, infection control guidelines and training, testing and screening procedures, nursing homes know how best to care for your loved ones than other settings. The nursing home is their home, and this allows them to return or never leave that setting. We started with our first COVID-positive dedicated nursing home in Jacksonville. We created processes to protect the staff and residents and the community. We perfected infection control procedures, screening, care processes for residents, and determining when it is safe to discharge someone back to their nursing home or community. Our regulators and other agency staff learned how to inspect and support the nursing home. We have now expanded to 23 dedicated COVID-positive nursing homes or units across the state. This allows residents to receive care from staff who know best how to provide that care, ensures that none of your loved ones who are COVID positive will have to be transferred more than 90 minutes to a specialized facility. We also have permitted nursing homes to create their own COVID dedicated units so their residents can be cared for safely in their own facility by the staff who know them. The Center for Disease Control has created guidelines for long-term care facilities to follow. These guidelines ensure that residents who are COVID positive, COVID negative, or in observation status are separated to prevent the spread of the virus. Staff, dining, linen, and other items are also assigned to each unit to prevent cross-contamination. We worked with the Florida Healthcare Association on a training webinar to teach facilities on the procedures they must follow to create these units. My team of inspectors, as well as infection control specialists from the Department of Health, The Federal Centers for Medicare and Medicaid Services, the county health departments continuously inspect these facilities. I want to ensure you the following. Whether your loved one does have COVID or does not have COVID, the safety of your loved ones is the governor's and my top priority. If they unfortunately get exposed to the virus and need hospital care, they will be transferred immediately upon presentation of symptoms that require hospital level of care. If they can be cared for in the nursing home, it will be by staff who are trained and in a unit that is equipped to care for them with the proper personal protective equipment and the right infection control processes in place. It will also be done in a way that protects other residents in the nursing home from COVID exposure. Another issue on your mind and on mine is visitation. I want to assure you that I recognize the physical and mental strain that the ban on visitation is taking on you, your loved ones, and our staff. But this has to be done to keep your loved ones safe while we learned how to best protect them from COVID. The governor and I are working on a plan to reopen visitation so it can be done safely. We hope to have safe visitation procedures in place in the near future. Thank you so much for your time watching this video and for your trust in us to care for your loved ones.